Bienvenue sur Health Talk. J'invite tout le monde de prendre part à nos émissions hebdomadaires qui se passent chaque mardi et chaque samedi. Donc, nous sommes ici bel et bien pour vous apporter toujours des topics assez intéressants et des topics que vous pourrez épuiser une connaissance ou une autre. Donc, comme je dis toujours, le but de cette émission est d'éclairer la communauté et de rendre la communauté beaucoup plus lucide vis-à-vis de leur santé. Donc, nous allons continuer le processus d'éducation, mais tout en continuant le processus, je vous demande de m'aider et je vous demande de disséminer, de divulguer et cette émission à travers la communauté et aussi bien à travers notre cher pays d'Haïti, une émission qui pourra servir beaucoup de gens en Haïti. Car en Haïti, les gens sont appauvris d'éducation. Je demande à tout le monde de prendre, j'invite à tout le monde de se rendre auprès de l'écran et pour y participer à cette émission. Donc, la seule façon de vraiment de divulguer, de disséminer et d'arriver à atteindre beaucoup de gens de la communauté, c'est par vous, que vous. Et comment le faire? C'est de partager l'émission avec tout le monde. OK? C'est la seule façon d'arriver à atteindre beaucoup de gens de la communauté, de partager. Donc, votre devoir civique, aussitôt que vous êtes branché, je vous demande de partager l'émission. OK? Bon, donc, bonsoir tout le monde. Soyez la bienvenue ici. Bonsoir à la ronde de tout le monde. Ici, c'est Dr Benoit. Moi, invité pour participer dans le show là. Moi, invité pour venir avec nous. Et puis, pour venir entendre conseils qui a aidé conseils médicaux qui a aidé que chose ça a pas l'autre but encore, c'est chose ça li c'est éduquer et puis pour la en pile mon pour faire mon beaucoup plus conscient de santé. Donc la seule façon pour les choses ça qu'arriver l'autre côté, c'est ou même qui va faire. Et j'en pour faire le moins aussitôt que vous branchez là, soit vous regardez là, ok, pesez sur petit bouton share, ok, alright, so fais plaisir là, fais plaisir là, share live là immédiatement, pas tant de pour faire long, fais le immédiatement pour aider l'autre prochain venir prendre un petit quichoy dans ça m'a dit là. Encore une fois de plus, moi remercie vous d'avance et moi souhaiter vous la bienvenue dans le show nous si là. Good evening. This is Dr. Benoit at your service, your loyal servant here tonight to bring you another show, a lightning show. And as you know, the goal of this program is nonetheless education. To reach the grassroots, to uplift the consciousness of the community, be a little bit more cognizant of its health, to make the community more astute of its health. But as I convey this show to you, it is impossible to reach everybody, and the way that I'm asking you to help me out is to live, this live, and all the lives with others. So do not wait for me to tell you to do that. If you are now, if you have not done so, I'm asking you to do it immediately. Yourself to do that, because by with somebody, you're gonna help a dear compatriot. You're gonna help a good friend, and you may okay, who has suffered from this ailment, and then the person sees the light. So, and I thank you in advance for your efforts. I thank you in advance for your support, and I thank you in advance for your cooperation. And thank you, and welcome to our show. Eh bien, ce soir, nous avons 2 topics comme d'habitude, chaque mardi, chaque samedi. Le premier topic, nous allons parler des infections urinaires. Ok, nous allons aborder les infections à ce qui a trait pour les femmes et pour les hommes. Et deuxième topic, il y a un fléau à ce qui a trait des mariages entre avec des liens qui sont très serrés. Par exemple, les premiers cousins, il y a beaucoup de cousins qui se marient. Et même récemment, il y a un État aux États-Unis, je ne me rappelle pas, même frères et sœurs arrivent à se marier. Donc, nous vivons dans un monde à l'envers, tout à fait à l'envers, et parfois on me demande si c'est la fin du monde. Donc, on va aborder ce topic. Donc, vous pouvez quand même passer votre opinion et vos commentaires. Bonsoir tout le monde en général. À ce moment, nous avons 2 topics comme d'habitude. Premier topic là, nous allons parler sur maladie, infection urinaire. OK? Nous allons regarder anatomie de passage urinaire des garçons. Nous allons regarder passage urinaire des femmes. Passage urinaire veut dire qu'on trouve pipi, c'est ça veut dire. OK? Et puis deuxièmement, nous allons regarder et une croissance exagérée des monde famille qui liées très proches cap mariés. Et oui, et premier cousin marié avec marié ensemble. Elle a dit que on a gagné et petite deux sœurs, petite 2 frères, petite un frère avec un sœur cap marié qu'on y a là. Nous allons regarder ça et qui est-ce que ça arrivait en pile dans la communauté haïtienne non? Est-ce que ça arrivait en pile dans l'autre communauté? OK? Et donc parfois on demander si nous vivons dans monde à l'envers. So tonight we have 2 topics as usual. The first topic we're going to talk about urinary tract infection. We're going to look at the anatomy of the male urinary tract. We're going to look at the female urinary tract, and then from there on, we will give you all the symptoms that you have and the treatment. And the second topic, there is a preponderance of marriages between close relatives, first cousin. And recently, in the United States, there's one state that allows siblings, brother and sister to get married. So we're living in a very crazy world, things that we never heard before. There are certain groups where that you have a great number of people married, like in the Jewish family, a lot of people married between one another. But in other culture, it's not that common. But we're gonna look at this and see that. So let me finish inviting some people here, and then we're gonna start well quick. Okay. All right. Let me say hi to some people here. Cani Olivier, mon frère, salut. Welcome to the show. Myriam Durand, salut, share the live. Cani, share the live. Myriam Durand, share the live. Bonsoir. Jen Lebin, salut, share the live. Eddie Janvier is my comrade in medical school. Is Dr. Eddie Janvier. Eddie, how you doing, Eddie? Nice seeing you, brother. I'm trying to put together a school reunion for all of us. We've been to the same medical school, but I have encountered a little bit of obstacles because of in terms of date. So we will see what's going to be 2020 when we can do it. The show. Edwige Joachim, how you doing, my dear friend? Welcome to the show. Guerre de la Mer, salut, share the live. Eddie, share the live. Edwige Joachim, share the live. Guerre de la Mer, share the live. Okay. Aliette Julia, salut, share the live. Rosnay Laguerre, share the live. Rose Magali et Ertienne, salut, share the live. Aliette Julia, bonne semaine à toi aussi. Moïna Taïcha Tarina, salut, share the live. Jessie Joseph, salut, share the live. Michou François, salut, share the live. Kerta Georges, bonsoir, share the live. Mickey Berthaud Inidwedge, salut, share the live. Rose Magali Ertian, encore une fois le plus, bonsoir, share the live. Ray GB, salut, share the live. Angeline Nestor, salut, share the live. Amélie Chevalier, salut, share the live. Dr. Robert Jean Lewis. This is a very this man is, I like his demeanor in terms of yeah, he has a great demeanor, intellectual demeanor. Meaning that very smart, very intelligent. He writes well. You can, when you read his recital about a trip, it's like you are embedded in the trip. He loves to travel. He's also a nephrologist, very smart, very intelligent. He writes well in English and also well in French. So, my dear brother, welcome to the show. We're going to talk about urinary tract infection. And I gave you the latitude to make comments, to add or to subtract wherever you feel. Okay? So, Robert Jean-Louis is a nephrologist in Jersey. Great guy, very smart, very intelligent. So, the topic that I'm going to talk about tonight, he knows it as well as I. Okay? Okay. Amélie Chevalier, share the live. Saint-Laurent, Saint-Laurent, salut, share the live. Wittenberg Simeon, salut, share the live. Maï Camille, salut, share the live. Chenia Telusma, salut, share the live. Michel François, ok, bonne écoute, share the live. Patrick Pélissier, share the live, salut. Stéphane Etienne, salut, share the live. Vincenzo Vitiello, salut, share the live. Michel Lebin, salut, share the live. Robinson Sanon, salut, share the live. And happy holidays. Welling Guerrier, salut, share the live. Fafa Romain, salut, share the live. Christy Love, salut, share the live. Shania Talisman, I think that the world is coming to an end, my sister. This is a crazy world, man. That's why we're going to talk about tonight. We're going to talk about tonight the prevalence and the rise and the preponderance of marriages between close relatives, first cousin, and recently in the United States, one state allowed siblings to get married. So we're gonna go over that, all right? Events René la tortue, salut, Shadow Live. Brutus, hey, brother Pam, salut, Shadow Live. Events jeudi, hey, garçon Pam, ça qu'a fait tonton. Welcome to the show, bro. Okay, welcome, Mango Toye, Society, Society Florida, wherever you are. Welcome to the show, brother. Okay, welcome. Suzy Blain, salut, Shadow Live. Marcel Denis, salut, Shadow Live. Beverly Damas, salut, Shadow Live. Aïe Louis Jacques, salut, Shadow Live. Rena Louis, salut, Shadow Live. Norma Clotaire, salut, Shadow Live. Maggie Ford, Maggie, my sister, how are you? How's my brother doing? Guy Ford, he's okay, very good. Enid Siermeville, Shudlaw, salut, Shadow Live. Elsie Joseph, salut, share the live. Everybody, please share the live, guys. Denise, Sarah, Amalia, salut, share the live. Les variétés de Sabine. Let me say something about Sabine. Magali Laurent, salut, share the live. Beverly Demain, salut, share the live. Les variétés de Sabine. I think that as Haitian and as a black person, I think we should uplift, we should elevate the professionalisms of one another. And I've seen this lady, Levaite de Sabine, in making preparation for great dinner, for parties. And she has this finesse. I should say she has this ethical finesse to put together a beautiful dinner table, and I think everybody who sees that we should congratulate her. She's doing she does a great job. As a matter of fact, I told her, when I inboxed her one time, I said, whenever I'm doing a dinner, I will make sure that I do hire her. And she does great work. And if it's for a free advertising, let it be, because that's what we're here for. We should elevate one another. I think that look at a page, you'll see the wonders that she has done. She's a great party a party person who really can give a great party. If you like to dine, if you love elegance, if you love finesse, this is the person to hire at your next dinner. All right. So invite to Sabine. Sabine, great job. All right, great job. And I think that we should be proud of you, of a black woman to be so talented. Okay. Okay. Event planner. Okay, thank you. That's the word. Thank you. Thank you. She's a great event planner. Thank you for the word. Gina Nelly, salut. Fonko Ifam, salut. Claudia Chirodi, salut. Shut alive. Fafa Romain, thank you for the word. I could not find the word. Very good. You see, when you deal with people who are really connoisseurs, when you miss your words, they find a word for you. Good. Thank you, Fafa. Sophia Temar, salut. Shut alive. But tonight we're going to talk about urinary tract infection. À soir, nous va parler de infection urinaire. When you look at urinary tract infection, yeah, she's doing a great job, Disha Saint Laurent. Okay, Fafa, good. When you look at urinary tract infection, you divide urinary tract infection into two parts: the upper tract and the lower tract. And I'm going to show you what's in the upper tract, and I'm going to show you what's in the lower tract in women and male. So, l'organe des infections urinaires, ou diviser appareil urinary tract là en deux levels. Non level en haut et on level en bas. Et les docteurs ont fait un diagnostic différentiel. Faut docteur connaît qui côté que pour le chercher, pour le garder, qui côté que il connaît que et symptômes et qui côté que ou gagner et symptômes et puis qui côté que maladie après bon diagnostic. J chéri, salut cher de live, Victor Lefebvre, salut cher de live. So l'important que pour que et docteur discerner qui côté que qui est important pour lui. So, on nous regarde premièrement et l'appareil génital d'un homme ou bien l'appareil urogénital d'un homme. Urogénital. Attends-moi. Let me look at the first slide. Give me a second, guys. Don't tell me I didn't take it. Là. Wow. Give me a second. I think I missed it. But anyway, let's look this one. All right. Okay. Now, this is the male urinary genital this is the male urinary tract. So you have two kidneys, all right, a right and a left, okay, and then you have two ureters coming from the renal pelvis going down, okay. So all up here is called the upper tract, okay. Then you have the bladder here, okay. Then you have the prostate here, right? That's the penis, and that's the urethra, okay. So all up here is called the lower tract, the lower tract, okay. So you see where if somebody has a problem up here at the bladder neck, and if the prostate is big, right here, all the urine gonna stay in the bladder, give you infection. If you have a stone here, along the tract here, if the stone is here, everything that is here, right, the urine will come from here and it will stop here. So up here, what you're gonna have a dilatation of the ureter. It is called hydronephrosis. Okay, so sometimes you may have bilateral hydronephrosis, meaning that you have something that block here and that block here. Not only you can have a stone here, you can have a tumor invading the ureter. Sometimes you may have a major cancer of the kidney called the renal cell carcinoma, which can invade all into the renal pelvis and get into the ureter and cause blockage. In some females, they may have cancer of the ovaries, cancer of the endometrium, causing blockage of the ureter. So all up here is called the the upper urinary tract. So along the way, you can have infection any place here. You can have an infection here, right? In the ureter. You can have infection here along the bladder. You can have an infection here in the urethra, okay? Called urethritis, okay? So the infection, so urinary tract infection can occur along the way any place. Okay. Bon, dis en créole pour nous. Dis en créole pour nous. Nous gagnons deux reins, ok? Un rein droite, un rein gauche. Dans jonction ça, relève rénal, pelvis rénal là. Et là, on gagne deux urètres qui descendent. On urètre droite, on urètre partie ça qui là comme ça. Il y aurait les lits de upper tract. Now, il y a un peu de bagages qui a causé ou gagné infection de upper tract. OK? Ou a une tumeur, une tumeur qui est plus commune. Il y aurait laissé, et du macho, nous là, OK, brother. Une tumeur qui est plus commune, il y a le renal cell carcinoma, qui a invade the renal pelvis, et puis, au gain tumeur, il vient descendre dans toute l'uréter, il cause blocage. So, le bon blocage là, so, qui veut dire que tout pipi, l'aile descend, pipi va un côté pour l'aller. Ouais, tout pipi, il était là. So, si pipi arrêté là comme ça qui passe qu'on y a là, partie ça, you voulez ça, on hydronephrosis. Hydro veut dire de l'eau, nephrosis qui veut dire on va qui problème à level of the kidney. So, ou ka gagner on ka hydronephrosis dans partie droite, ou ka hydronephrosis dans partie gauche. Right? Alright. So, gen moun tou qui on gen stone, ou ka gen stone along the way dans tout le de kidney yo. A kidney stone is probably the fourth common cause of end-stage renal disease. So kidney stone is not a joke. Kidney stone can destroy your kidney. So when you have kidney stone, which is a urinary tract infection, that can cause to end-stage renal disease. So if you have two stone here, those stone can cause blockage of the ureter. So this is called the upper tract infection. If you have a cancer, if you're a woman, if you have cancer of the ovaries, if you have cancer of the endometrium, you may have metastatic cancer invading the trachea, causing obstructive uropathy. Okay, obstructive uropathy is a big word. It means that the kidney, the ureter, the path is blocked. Now, you may have also infection of the bladder. Okay. In male, the most common cause of male, that's your prostate. And this is the bladder neck here. So the prostate, if the prostate get big, the bladder neck become narrower. That means that you cannot empty your bladder very well. And then hence you have urine that stays in the bladder, causing you to have an infection. And then you may have infection of the urethra, causing infection of called urethritis. So, je parle plus anglais que créole. Comme on dit à l'heure là, ou ka gagner un cancer qui cause blocage de ureter, ou ka gagner aussi bien de cancer qui sortit à partir de endométro, c'est-à-dire utérus, cervix, ovaries, tout ça a causé blockage. Deborah England, how you doing, Deborah? Deborah, so far so good, right, baby? I'm speaking your language now. Let me say that in Creole now, baby. Okay? All right, stay put. Baby Gina, salut, shut alive. Belonson, wonderful, salut, shut alive. And here you have là ou gagné bladder là, dans bladder là ou ka infection tout. Et dans garçon ou gagné là en bas là ou gagné your prostate. And here dans petit point là ou gagné your bladder neck. So les pour ça do go en pile, so li empêcher pour pipi à sortir dans bladder pour le descendre, so li ka bo on infection, li ka go give you a bladder infection called a cystitis. A cystitis. And also you can have infection of the urethra called urethritis. So that's the male genital. That's the tract for male. So along the way you can have infection in those places. So when you look at the okay, baby, very good. So when you look at the kidney, you look at the upper tract and the lower tract. What can you have in the upper tract? What infection you can have? One common infection you can have in the upper tract is called pyelonephritis. All right, pyelonephritis. You see the word pelvis. Okay, you have infection around there, right? Pyelonephritis, okay? And that's an upper tract infection, right? Which requires sometimes hospitalization, all right? On the contrary, the lower tract infection can be treated as outpatient. Aziri Magali Dosmas, Salut, Shut Alive. Julian Azor, Salut, Shut Alive. Now, so when you look at the upper tract, you have pyelonephritis. When you look at the lower tract, you have cystitis and urethritis. Okay? So that's the way they divide them. Now, when you look at the upper tract can give you serious problem. And that's why sometimes those patients present very ill. They're ill. And if it's not treated properly, they can become septic. That can have an abscess of the kidney. Yes. So the upper tract is something serious. That's why that whenever you have such an infection, the patient has to go to the hospital and get care. So, je crois que nous comprenons bien là. Me disons que les kidneys, ils divisent en deux parties, en haut et en bas. L'organe problème là, tout là comme ça, you will upper tract. Okay? You know, c'est pyelonephritis, ou ka gen là comme ça. Okay? Right? Là comme ça, you will lower tract. Okay? Lower tract. Okay? So, là, ou ka gen bladder infection, ou ka gen urethritis. So, ça c'est pour garçon, en termes de Jean garçon présenté. Now, so, m'ba monter nou konye là, parti femme nan, qui Jean, on femme, track you the same, but except que, et contenu anatomique yo, un peu différent. Okay. Now, for femme, for a woman, you're gonna see is different. All right? For a woman, you're gonna see it different. Now, again, in a woman, that's the woman. You have two kidneys. You have the ureter, right ureter and left ureter. You have a bell-shaped organ. This is called the uterus, with a right fallopian tube and a left fallopian tube. Okay, and the uterus is the bladder. Okay? That's why when you have a big uterus, you're going to have problem with your infection. And here is a urethra. Okay. All right. So now I give the explanation in English. Let me satisfy the people who speak Creole. Now, tout à l'heure, nous te montré nous partie garçon. Kounya, on va monter partie fille. Partie fille, elle est presque même bagarre avec garçon. Except que garçon gagne prostate, femme nan gagne utérus. Donc, ou gagne, comment dire que, ou regarder ça, c'est parti en femme, ok? Ou regardez là, ou gagne deux côtés ça, ou gagne deux kidneys, ou gagne de renal pelvis, ou gagne ureter qui descend là, ou gagne yon droite, yon de gauche. So, tout ça qui là comme ça, yon relève upper tract infection. Ok? Là, ou gagne uterus là, et puis là, ou gagne the bladder, et puis là, ou gagne sphincter qui là comme ça. Et ok, sphincter of the bladder, et puis là, ou gagne the urethra. So, ou can gagne infection tout along the way here. You can have infection you can have infection at the level of the ureter. You can have infection at the renal pelvis. All right. You may have pyelonephritis. That's the upper tract. You may have infection of the uterus. You may have infection of this is called endometritis. It's called endometritis in women. You may have infection of the bladder, called cystitis. You may have an infection of the urethra, called urethritis. And in women, you may have pelvic inflammatory disease, PID. Okay, that's where you have all your pelvic inflammatory disease around here. A lot of women catch those things. So women tend to have more infection than women because they have more places. Marie Damas, t'en fais pas. Women tend to have more infection than men. So therefore, that women are more because they have more anatomical structures. Hence, they have more infection. Hey, ben moi qui est-ce que salut là? Let me say hi. Betty Bella, comment ça va Betty Bella? Salut. Lucie Classe tout le temps. Salut. Share the live. Betty Bella, share the live. Maris Damas. Salut, share the live. Jude Trevor, my brother. Share the live. Joseph Defay. Ça casse papi. Moi, fume mon cigare là. Qui a un cigare ça encore? Fume long fois déjà. Qui encore? Papa Doc. I tried with Jacques Mel avec Dr Kala Tortue. I didn't like it, man. I don't like it. M'pa connais si ou fait but I tried. Mais même pas fumer cigare, si cigare pas si cigare pas full body cigar. I cannot smoke a cigar that is not full body. I don't feel anything. I must have, when I smoke a cigar, I must feel a buzz. Mbagwane, Tito, mbagwane kounya si ou fait Papa Doc là, mais préfère me maintenant, I didn't like it. So si Papa Doc gen yon ki full body, I don't mind buying a box and see what it feels. But before I buy a box, I wanna smoke one to see how it feels. Si son middle body, I don't want it. It has to be full body. Okay, bro. Definitely don't salute you alive. Mildred Tassissimo, my sister, how are you? Shut alive. Panorama Up Pictures, salut, shut alive. Fabi Pétion, salut, shut alive. Yvon André, le grand Yvon André, ça c'est gros musicien, tabou combo, faut monter à obligé stop pour saluer parce que they if Haitian worth value are artists, Yvonne should have been in the Hall of Fame, along with all the jazz, all the musicians. For Fanti Bot, they should have been they should be in the Hall of Fame. There should be the analogy of the Beatles of England. But although Tabou Combo is well recognized around the world, but I don't think that we Haitian value understand the culture of Skasha Combo, like Chouchle, like Volo Volo, like Difficile, Gypsy, Musique, those bands, Loulois, tout jazz ça created such a great impact in the Haitian culture. And when you listen to the new generation, they sound the same. You know, sometimes there are no lyrics, but you see, l'op gade on musique concours. Excusez-moi si me font dévier, but I have to sometimes. L'op gade on musique concours. City, man, New York City, Baby Paramount. Musique ça va pas jamais mourir. That's where you see, you understand that a song is a hit. After 30 to 40 years, the song remains vibrant. Musique jeunesse kounya la, si autant de kounya jodi la, si ne pas font l'autre plaque, l'autre musique là, li pas gen valeur encore, li perdu valeur. Vous comprenez? L'obtenir des design longtemps. Les design, l'obtenir des design, ou musique design. Ouais, monsieur, il pas jouer musique ça encore, parce que, pas dire ça par la mode encore. Mais ça te qu'on nice rhythm. JetX, tout ça pas jamais passé mode. That's why que longtemps, they qu'on fait musique pour musique. Vous comprenez? But right now, I think different. Anyway, sorry if I deviated. Yvonne, Brother Pam, with all the love, all the respect, welcome to the show, bro. Junie Batemi, Salut to the live. Love Love GJ, share the live. Deos sans complexe, share the live. DS Sakmet, Salut to the live. So, we went over the anatomy of both both sexes, for you to understand the anatomy of women versus female. Now, I told you that there is a upper tract infection, for example, pyelonephritis. When somebody has pyelonephritis, right, the person will have terrible pain. And usually, the pain, in terms of localization, the pain is there, right here. If I have to make it a little bit smaller for you, it's right around your flank. All right? Salut naturellement, mais l'organe douleur et pyelonephritis, organe douleur, bon jaune et agou. Et qui sont sentis? Vous sentez la fièvre, et là, c'est à 102, 103. Ou gagnez frisson, ok? Ou qu'à vomi, en pile parfois, et corps faible, et puis ou gagnez douleur atroce. Okay? So when you have acute pyelonephritis, this is an affection that needs medical attention, because the patient would present with fever, chills, vomiting, weakness and a feeling of feeling sick, very sick. And the pain is usually around the flank. And when the doctor examine the patient will have either left or right costal vertebral tenderness. All right, this is called CVA. All right, so the doctor will give a thump in the back of the patient. The patient will jump. All right, so that's the indication. Now, and usually they don't do sonogram in emergency room. They'll do a cath for you, and they'll see that you have an infection. Now, for a patient who has acute pyelonephritis, it is an indication for you to be hospitalized, because acute pyelonephritis we can have an abscess, and the abscess you can go into full septicemia and you can die. Lè que ou genyen acute pyelonephritis, li mandatoire pour docteur admettre l'hôpital. Dr. Carlo Tartu, brother Pam. That's a brother from another mother. Hey, bro. Welcome to the show, bro. Welcome to the show. Welcome. Carl is my brother. We've been friends for a long time. So whenever I see him, I'm happy to see him. Bro, welcome to the show, bro. Welcome. So when you have acute pyelonephritis, you have, it's mandatoire pour moun à l'hôpital. OK? Parce que c'est la différence entre infection of the upper tract and the lower tract. So, because si vous pas aller dans l'infection, ou pas le docteur, ou si vous pas dans l'emergency room, ça a causé ou ka gon abcès, ou renal abscess. And then ou gagner, ou vin konyen là, ou vin gagner on septicemia. C'est-à-dire que bactéries li envahi tout corps konyen là, et puis ou gagner, tout dépend de bactéries gagner. Si c'est bactéries qui cause by staph, les bactéries qui causent par, parce qu'il y a deux types de bactéries. Il y a des bactéries à titre gram négatif, il y a des bactéries à gram positive. Si pas ce patient qui est gram negative always goes into septic shock. OK? Par exemple, si vous avez une bactérie comme Proteus, vous avez une bactérie comme Pseudomonas, or Klebsiella, all these are gram negative bacteria that are fatal. Fatal. So, nothing much, brother. Nothing much. Strong as a bull. And we're doing what we're supposed to do. All right, bro? All right. One love, my brother. One love. So, là important. So, when you have acute pyelonephritis, you must be admitted. And the doctor cannot give you medication orally. You need antibiotic. Okay, so bro, why don't you turn off your phone and then come back again. Yeah, this happened many times. All right. So turn off your phone and then restart it. So when you have acute pyelonephritis, the doctor cannot send you home. Okay? And that would be a medical negligence if the doctor send you home with acute pyelonephritis. You must be admitted. And usually sometime if everything goes well, 3 days, the maximum 5 days, sometimes you can, as long as they're still antibiotic, and then you can go home later on and then get you to with all medication. Now, if you present with hydronephrosis, that's a different story. Yeah. So, what is hydronephrosis? That means that you have dilatation of the renal pelvis. Right? You become dilated. All right. So, if you have an infection, the doctor will need to calm down the infection, treat the infection, and then when when the infection is under control, the doctor can go. If you cannot pee at all, they have to put a nephrostomy tube for you, right? Or they put a stent for you. Yeah, they put a stent with a nephrostomy tube. Oh yeah, c'est ça le toto. Ou t'es sous zéro, c'est l'argent, c'est l'argent, c'est l'argent, c'est l'argent. C'est l'argent, le toto, ouais. Eh ben, n'a grimpé l'argent là, doucement, hein. Doucement. En tout cas, bonne écoute, brother. Bonne écoute. So, if you have hydronephrosis, that's again, the doctor will not do any intervention at this time. They will make sure that they calm down the infection, give you antibiotic, and then they'll go in either they put a nephrostomy tube with a stent. Now, and they might send you home with a nephrostomy tube, and they will see because usually put a nephrostomy tube, all you see is debris, right? It's a way to clean up clean up your tract. So the tube will remain there for a while until that there's nothing else that is coming out of the nephrostomy tube. And then after sometimes it takes about 2-3 months, the doctor can go back and can go and remove the nephrostomy tube. There's some people that put a stent for them, and then after a while they do a sonogram and they see whether or not the tract is back to normal, and then they can remove the stent. Okay, that's people with hydronephrosis. That means that you have dilatation of the renal pelvis. Okay, now again, hydronephrosis can be due to kidney stone or cancer. So, pour moun ki genyen maladie, lè ke ou genyen pyelonephritis, soit l'emergency room, faut que tu aies bon médicament et IV dans veno, et docteur pas capable la caillou. Si vous voyez la caillou, c'est ou ka considérer ça ou ka considérer ça comme un medical negligence. Docteur supposé admettre bon antibiotique via IV et puis you monitor et puis parfois on était 3-4 jours à l'hôpital là, il boit IV antibiotique et puis après ça il va la caillou, il va continuer le médicament pio. Now, si que vous gagnez hydronephrosis, c'est-à-dire que vous gagnez dilatation of the renal pelvis, ok, qui due à un stone, ok, docteur lui-même ça les fait, il a mis un nephrostomy tube, c'est pas rapide, il y a qui gagne baladol hydro, tous les deux rien bloqué. Parfois ils mettent tous les deux nephrostomy tube pour maintenant. Parfois ils sont seuls, ils mettent un seul nephrostomy tube là. Mais nephrostomy tube là pour nous, nephrostomy tube là, c'est un gens pour retirer tout débris qui dans une tract là. Et puis voilà kawavel et puis et docteur la monitorer et combien ba qui sorti et combien ba qui débris qui sorti là-dedans, et puis là que pas grand chose là-dedans, docteur au cartonner back et puis docteur retirer les nephrostomy tube là. Les patients tous ces stent yo mettez pour yo. Mais ton stent en les mêmes ça stent là c'est fait. You essayer bring the pelvis back to a little bit normal, right? To back to normal to a normal size. The stent can stay there for 2-3 months, but you have to go and get the stent removed. Many patients sometimes they don't go back. En plus patient you pas tourner back pour remove stent yo. Et puis stent yo come back problem. So let me to stent pour you have to go back to the doctor for the stent to be removed. Understand that. Sometimes you call doctor doit dire que bon kidney pour get better, you remove the stent, they put another one. Okay. That's for the upper tract. The lower tract now, the lower tract is different. The lower tract, you can have cystitis, you can have urethritis, you can have prostate, you can have endometritis, you can have PID, all these do not merit hospitalization. They can be treated as outpatient. Do you see the difference? Do you see the difference? Everything that is low, you don't necessarily need hospitalization. For example, un patient qui gagne lower tract infection, qui ont senti, ou gagne un bâti ventre formal. Okay, let me show you guys. Let me show you. Okay, this is what you're gonna see. All right, it's burning. All right, it's burning. All right, that's lower tract. Again, ou ka senti ou constato. Hey, this is all lower tract. All right, so ka senti douleur à constato. Okay, all right. This most likely is people with upper tract infection. You see, that's flank pain, and that's the upper tract. So for women, no, let me see for men. Okay, login cystitis. Let me say hi to some people here. Let me say hi to people. Nancy Mayome, salut, share the live. Nadine Daisy, salut, share the live. D Love Celebs, salut, share the live. Chantal Austin, salut, share the live. Darlene Coutois, salut, share the live. Wilson Benoit, salut, share the live. Nana Bravo, salut, share the live. Maris Damas, okay, well, do the same thing, sister. Turn off your phone and then restart it again. Marie Saint-Pierre, salut, share the live. Lisette Brunesh, salut, share the live. Bebe Gina, salut, share the live. And thank you for the compliment. Amelia Ingrid Lera, share the live. John Jonas, salut, share the live. Bebe Gina, Dinake, how about renal failure? Good question. Now, I don't want to forget your question. Let me say that. Now, in patient who has acute pyelonephritis, you may have acute kidney injury. This is called acute kidney injury. That's a new terminology. Due to sepsis, yeah, because if you're septic, your blood pressure is low, you have septicemia, that can cause acute kidney injury, which is transient. That means that it is temporary. Once the infection is controlled, your kidney is back to normal. Okay. In patient with bowel hydronephrosis, who and hydronephrosis has been there for a long time, not taken care of, the patient can go into chronic renal failure and then end up in end-stage renal disease. So patient with recurrent kidney stone or recurrent nephrolithiasis, it is the fourth or the fifth common cause of people end up in dialysis. So kidney stone is not a joke, because if the stone block the tract, then you're gonna cause detriment in the renal function. So therefore, that yes, patient with kidney stone can end up having chronic kidney disease and then lead to end-stage renal disease. Okay, baby? Now, so for the lower tract, as we're saying, as I show you that you have pain at the bottom here. So your bladder is tender. When you pee, it burns. Okay? When you pee, it burns. You pee a lot. Right? You may have fever. You may have chills also. All right? You may be vomiting. So depending on the age of the patient, depending on the underlying medical history of the patient. If the patient is very, like, for example, if you come to the hospital, you have a cystitis, and then you vomiting a lot, and then you are, I don't like to say the word dehydrated, because that's not the right term. Is when you feel volume contracted, that means that the volume of your plasma is reduced. Then you can have acute kidney injury also, and then that kind of patient, you cannot send that patient home. That patient has to be hospitalized. So sometimes the doctor has to make the correct decision depending on which patient that he's facing with. So but usually cystitis can be treated as outpatient. Okay, as a patient. All right. So you have, as I showed you, for cystitis, you have right here. All right. It's painful. You have fever, you have chills, you feel sick, all right? The doctor can give you, if it's and many times patients walk into the office, they have cystitis. You give them pure antibiotic, okay? One group of medication that is good for low tract infection are the quinolone derivatives, all right? The quinolone derivatives, they are very good for UTI. You talk about ciprofloxacin, Avalox, Levaquin. This is all quinolones derivatives. All right. Okay. All right. But you can give also a second generation of cephalosporin. Yeah, you can give it no problem. All right. You can even give also. You can even give also a first generation. All right, no problem. Okay, all right, and you tell the patient to drink a lot of water. Should be okay. Now, for prostatitis and urethritis, again, these are lower tract infection. Again, you can give pure antibiotic. Again, a patient with urethritis and prostatitis, patient gonna pee a lot. You're gonna burn. You're gonna feel that when you pee, it's so hot. Then the doctor knows you do a culture. Yeah, you always do a culture. I think that I'm just answering your question now. Listen to me. So you have prostatitis, you have urethritis. The patient will pee a lot, burning sensation, polyuria, pee a lot, and then the doctor will do a culture and see which antibiotic to give you. All right. Now, so a woman can have what you call endometritis. That's an infection of the uterus. Again, the patient will feel pain at the lower part of the abdomen. Okay. Again, that will cause a lot of burning, a lot of pain at the level of the lower part of the abdomen, and then the doctor will give you infection. Now, there's something called PID, called pelvic inflammatory disease. All right. Usually, it's caused by a bacteria. All right. And usually those patients, when they come in, they're sick. All right. They have pain around here. Let me show you. They have pain around here. Yeah, they have pain around here. Okay? They have pain around here. And usually you see pelvic inflammatory disease usually in young sexually active female. OK? Moun qui nan sexe qui va sa qui cause pelvic inflammatory disease. Et puis like sometimes those patients they have to be admitted if it's sometimes they may present sometime with pelvic abscess. With pelvic abscesses. Those patients may merit hospitalization. Okay? But overall, most of this patient, if you have a high fever, you have urinary tract symptoms, the doctor will do a blood culture and the doctor will do a urine culture. Why? Now, although you may know which bug that cause Bébé-Gina, I'll answer you very soon. Although you know which bug will cause you to have an infection, but it's important that you know you do a culture and sensitivity, meaning that which bug is more sensitive, which bacteria is most sensitive to a particular antibiotic. So the doctor will give you a better treatment, but the doctor will start you on prophylactic antibiotic just to relieve your symptom. But the doctor will eventually give you the best antibiotic, because sometimes if you do you give the patient an antibiotic, that antibiotic may not be as efficacious as the antibiotic that is prone to cure you. So the doctor will give you a prophylactic antibiotic, but the doctor will wait for the culture to come back to give you the proper antibiotic to cure your infection. Okay? So most of the time, the doctor will do a blood culture. If you have a high fever, usually blood culture are done in the hospital. Okay? All right. The doctor will not do blood culture as our patient, because as our patient, you must. If you doctor will do the blood culture as a patient, that means that you should be really sick. All right. So if you're that sick, you cannot be home. You have to be in the hospital. So a blood culture is usually done in the hospital, but the doctor can do a urine culture in his office and then give you antibiotic, and then in 3 days he calls you, tells you, ma'am, the antibiotic that I gave you is not the right antibiotic. Now, there's what you call complicated UTI, a uncomplicated UTI. A complicated UTI is like the pyelonephritis. It's like the adenonephrosis. That's called complicated UTI. These UTIs must be treated in the hospital. On the contrary, the uncomplicated UTI can be treated as outpatient. So, il y a deux types d'infections. Il y a une infection qui est compliquée, il y a une infection qui n'est pas compliquée. Infection compliquée, moi, je dis déjà, c'est maladie pyelonephritis, hydronephrosis. Ça y est, ou supposé à l'hôpital pour le docteur bon antibiotique IV. Tandis que, en uncomplicated UTI là, docteur lui-même, il a choisi pour le bon antibiotique, qui n'est pas même moyen de faire culture parfois, c'est pas vrai, mais d'habitude, docteur tout fait lui. Ouais, il uncomplicated, il bon antibiotique, il espérer que within a couple of days you get better. If you don't get better, the doctor probably will do urine culture. All right? So, and also you drink a lot of fluid. Now, patients who have kidney stone are very tricky. Now, kidney stone, I think I talked about kidney stone already. Kidney stone is a disease of the affluent people. And 12% of the population tend to have recurrence of the kidney stone. They have all type of kidney stone. They have calcium phosphate stone, they have calcium stone, they have oxalate stone, they have cystine stone, they have all kind of kidney. There's a uric acid stone, they have all type of stones. But the majority of the stone, the reason they have stone is because that is the way you eat. Right? People who are very affluent, people who eat a lot of restaurants, they tend to have a lot of stone. Malheureux pas fait maladie kidney stone. OK? C'est grand nègre qui fait maladie kidney stone. C'est maladie of des affluents. Ouais, mon k'ap manger gros bel gros steak. Monsieur ça qui gagne kidney stone. Malheureux pas fait kidney stone. OK? So, et il fait comprendre que 12% l'organe kidney stone ou gagne temps pour gagner tout le temps. Okay? At least 12% of the time. Et like with kidney stone, the way to get to really take care of kidney stone is really by prevention. And what do? You drink a lot of fluid. You should drink at least 1.5 liters of water a day. What is 1.5? It's like about 1.5 gallons of water. And that's where the gallon of milk, like this, you take 1 gallon plus half one. That's about 1.5 liters to maximum 2 liters. You should eat a diet that is low in salt. All right? All right? And the third, you should eat a diet low in protein. So, la façon que vous moun ki en question, c'est par prévention. Prevention is the best thing. Et prévention, ça ou fait, ou boire un peu de l'eau, ou supposez boire at least 1.5 liters of water a day, ou supposez prendre une diète qui pas gain trop protéines, et puis ou supposez prendre une diète qui pas gain trop sel. Choli la Roche, Shadow Live, salut. Amélie Chevalier, Negbo pour moi, salut Shadow Live. Rose Magali Ertiam, Shadow Live. Kertajo, tu es de auto, Shadow Live. Gary Sylvain, hey brother, how you doing, bro? What poem we? What poem samedi? I'm coming to support you. Okay, Shadow Live. Maud Valcourt, salut Shadow Live. Nadia Delvime, salut Shadow Live. Hello Derival, salut Shadow Live. Elionaire JB, salut Shadow Live. Camille Olivier, salut Shadow Live. Louis Gaëtan, salut Shadow Live. Marie-Lo Delerme, salut Shadow Live. Myriam Saint-Lô, salut Shadow Live. Tout le monde, Shadow Live. Jibon Gary, salut Shadow Live. This is the end of the first topic. Ça, c'est un de premier partie que n'a parlé là de infection urinaire. OK? Ou n'y a là, maman dit, est-ce que nous avons une question sur maladie ça? If Dr. Robert Jean-Louis is still on watching us, brother. If you like to say a word, I can put you on, or if you want to add something, feel free. Okay, bro. All right. Dr. Audelaire, Robert Jean-Louis is a nephrologist. He knows those diseases as well as I do. So, brother, if you're still watching, if you like to add something that I've missed, feel free and interject. Joanne Lucien, salut Shadow Live. Est-ce qu'il y a des gens qui ont une question? Rose Magali Ertiam, you're welcome there. Any question? Any question? Any question before I move on to our second topic? Any question before I move on to our second topic? Any question before I move on to our second topic? Do you have a number that you can call? If you have a question, Disha Saint Laurent, after the show you can inbox me and I can answer you. Okay, baby, I know you asked your question, and I think I've answered you. No, endometriosis is not in the group. That's a different story. Yeah. What's Magali? That's different story. That's not part of the urinary tract infection. No. It's different story. Something different. Yeah. Maris Damas, you asked a question. Okay, very good. And I did answer you. Anybody has question? Anyone has question? If you have questions, feel free to ask me. Oh, that's true. Yes, that question. Baby Jinaker, how about frequently urinate at night? Well, let me tell you. There's a physiology when you sleep at night. When you sleep at night, you have an increase of renal blood flow going through your kidney. And hence, the better flow you have, then because you're in a supine position, all the blood going through your legs, going back, and then go to your kidney, you have a better renal blood flow, and hence that you tend to urinate a lot. Now, but in males, young men, like Dr. La Tortue and I, we tend to sometimes pee a lot at night because as you get older, your prostate is enlarged. Okay? Because what happened is not that because that you're making a lot of pee. It's because you never empty your bladder entirely. Because you see, at the level of the bladder neck, if the prostate is big and the bladder neck is very narrow, so you tend to pee a little bit, and then after a while you pee again. You're gonna pee again. So all males, that's the truth. If you're 50 years old, your chance to have enlarged prostate is 50%. If you're 60 years old, your chance to have enlarged prostate is 60%. If you're 70 years old, your chance to have a enlarged prostate is 70%. If you're 80 years old, your chance to have enlarged prostate is 80 years old. If you're 90 years old, your chance to have an enlarged prostate is 90 years old. That means that every single male who has lived a long time, they're sure they'll die with one disease. It's called BPH, benign prostatic hypertrophy. So, tout garçon, gon maladie ça mourir quand même, tout garçon net. Si vous avez 50 ans, vous avez 50% de chance pour gagner un gros prostate. Si vous avez 60 ans, vous avez 60%. Si vous avez 70 ans, vous avez 70% pour gagner un gros prostate. Si vous avez 80 années, vous avez 80% pour gagner un gros prostate. Si vous avez 90 ans, vous avez 90 ans pour mourir, pour gagner un gros prostate. Qui veut dire que tout garçon net en général, même si nous nous tous à mourir avec une maladie, ça quand même, c'est maladie gros prostate là. Ça son bagage qui clair. Right? Exactement. All right? So definitely that probably be one of the causes why male tend to go to the bathroom a lot. Maggie Mother, is it true women who wear tight blue jeans are susceptible to having UTI? Yes. Yes. It has been shown that. Yes. Yeah. Exactly. Yes. Est-ce que pas pourcentage là? Pas que pour les pourcentage non, Benjamin. Pas que pour les you know. Too bad. C'est mourir pour ta mourir bonheur. Et soit j'aurais pour ta mourir bonheur dire. Anine Bobien, mon pam salut chat de live. Jenanelli, mon pam salut te bête. Donc the fight. GQ. Hey, what's up, guy? What's up, guy? Welcome to the show, brother. Welcome. Marta Sempagno, salut chat de live. Colette Gelu, salut chat de live. Any more questions, guys? Okay. Next topic. There is a rise in marriages between close relatives. When I mean close relative, I'm not talking about second and third cousin. I'm talking about first cousin. That means that the children of two sisters, the children of two brothers, the children of a brother and a sister, first cousin. First cousin. There's a rise. Now, we know there are some cultures that this kind of practice is very prevalent and true, but now it has become a major observation in many cultures that you see people who are so close getting married. It's like they don't see anybody else but their cousin. And recently, I don't remember what state there's the state. It's in the Midwest. You know, that's where this whole thing happened. Yeah, the Midwest. There's a state in the Midwest. They have allowed legally allowed siblings to get married. If it is not nuts, I don't know what this is gonna be. So we're living in a different world, whereby that people don't see their sisters anymore as themselves. But for you to go to bed with your brother and your sisters, there must be some kind of psychological disequilibrium. I mean, of all the women in the world, if one chooses to sleep with a sister, something is wrong. Now, I don't know how prevalent it is in the black community. Maybe some of you will tell me. In the African American community, I don't know how prevalent it is. But many Haitians do marry close relatives. Yeah. Many Haitians do marry close relatives. And it's under the rug. It is not, there are a lot of things in Haiti that not spoken because we are so culturally restrained to talk about those things. But true enough, many Haitians do marry close siblings. Predominantly first cousin. Now, and it is so mind-boggling, it is so disconcerted that you wonder at what point people gonna go. Is it at the end of the end of time? Will a state allow a son to marry his mother? That's crazy. If you can allow two sisters to get married, eventually, will they say that it's okay for you to marry your mother? That's craziness. I don't want to bring judgment on people. For me, c'est for me. Gazopam. For me, c'est for me. Welcome, brother. Welcome to the show, bro. Welcome to the show. Share the live, bro. Share the live. Oh, Mata Sempagno. That's something that I didn't know. I didn't know about that. But it is to show you our mind is so sick. We're living in a different world. The world is upside down completely. For a state to allow two siblings to get married, that's nuts. So sometimes you try to understand the mere comprehension of those people that among all the women in the world, for a brother to seek love, he has to seek his sister. He has to go to bed with his sister. So, what's going on? What's going on with our world? The world is really turning around differently. We're living in a different world. And it seems to me that things that we used to say that is not normal, they have become some kind of normality in the society that we live in. So the precedent of this craziness, what's going to happen? What's going to happen is that the next generation gonna think that to marry your sister and your brother is normal. And further down, they're gonna think that to marry your mother, your father is okay. This is the world we're living in. This is the sick world living in. So, là que on dit que on ka marié avec même, avec sœur. Génération qui vient là, là pour être marié normal. Longtemps, nous te gardé même là que on est respecté tête ou même zami même madame zami ou pas supposé garder pour femme. Ou pas jamais supposé garder. Et même si que ou t'attendais que zami ça bon je prenne, ou pas supposé al derrière madame zami ou. En pile nèg fait ça. C'est que ou pas jamais des amis nèg là vraiment. Ou t'es des madame nèg là. Ouais, c'est jusqu'au point où on arrive. Même zami, même madame zami ou, li sacré. Li sacré. Ou pas supposé garder madame zami ou même pour ta penser pour ta filer li si nèg ta mouri. Et or, ou ap garder que pour quitter for the society to accept, to allow siblings to get married. It is craziness. So what's going to happen to the next generation? The kids who are born today, they are born in a very crazy world. Because they will not know what is right and what is wrong. They will not know what is right, what is wrong. So any kid who's born today is a kid with a lot of that's a kid that's going to be confused. Parce que kounya là, yo quitté deux femmes mariées et deux femmes qui ont petite. Hein? Si moun sa kap levé nan famille ça. So, la confus, Abdou gen deux mamans. Yo quitté deux garçons, levé, un petit garçon. Petit garçon la levé, la pensé que li normal pour deux garçons vivant dans caille. Hein? Ouais, qui problème petit monde? So, les ko quitté deux sœurs mariées, yo fait petite. Et l'autre qui était un frère en sœur marié, il fait petit. Marjorie, yes, I know you're late today. You're late. L'autre qui était un frère en sœur marié, il fait petit. Mais si mon ça qu'a fait là, mais ça pas penser là, il pas penser que sous fait un petit garçon, un petit fille, il kamaya sur tout. Il vit normal pour lui. So it's going to be a vicious cycle. Let me see. Let me see. I see some people here. Some people have made comments. I don't want to make sure that Kathleen dit que it is sickening. First time I heard. Now, it's there. It's out there. It's out there. It's out there. Julian, that's the kind of world we live in. That's true. Kathleen said, I saw a document on YouTube. 3 moms from Africa married their sons. Yes. Mel dit que that could be in Asian culture. When your parents disapprove someone, they have a reason. True. Yeah, true. True. Now, let me ask you a question, guys. All right. If maman une question, femme qui là. Supposons que nous gagnons un petit fille. Et puis li remet à nèg. Et puis ou pas connaît que il gon frère. Et puis petit fille là il vient remet avec frère ça. Et puis il pas préparé pour marier. Est-ce que ou start mariage là? Est-ce que ou continue mariage là? This is the question that I asked the audience. Let me say that in English. Let's say that you have a daughter. Your daughter has a boyfriend. But you never knew that your husband had a child about the same age as your daughter. And then they met easy on social media. They got involved. And even your husband never knew about the son also. And then by tes oreilles, somebody told you that this is the child of your husband. They are brother and sisters. And they're about to get married. Would you allow the marriage or would you cancel the marriage? Question for you, my black sisters, my black women. Let me hear your voice. Let me hear your voice. Famille, c'est vrai que Facebook bloqué jusqu'à 9 décembre pour ne pas partager. Oh, ok. À la fois, hein? Famille, c'est famille. Il faut grand pile, hein? Ok, brother. Ok, no problem. En tout cas, you can watch. You can watch with us. All right. Deborah is like, so true, crazy. That's why we have to stick to the word or to the Lord. Either or. Lilene Antoine, salut. Shut alive. Nicole Delian, shut alive. Mott MU, how you doing, sister? Shut alive. Antoine Bazar, shut alive. Rosemary Yake, there is a case where mother and daughter are in lesbian relationship. Mes amis, bon, ça bien. This is crazy. This is crazy. This is crazy. My God. Wow. There is a case where a mother and a daughter are in lesbians relationship. That's absolutely crazy. Very soon, you're going to hear a son and a father, they're having homosexual relationship. That's not me. This is crazy, guys. That's crazy. T'as l'air d'entendre un papa avec un petit affaire ici. Ils sont là, là. Ils sont là. Tu vas entendre papa, petit affaire ici. Si maman a avec petit café lesbienne, papa, petit affaire ici. C'est chargé. Craziness. What's my gali? Mais c'est pas mon blanc, pas mon noir, mon ça, c'est mon blanc. Et c'est moi qui a tout fait avec ça. Marjorie Dubois, how you doing? Alphonse Gonzalov, I'm fine, I'm fine. And you? Welcome to the show. Magali Laurent, salut, shut alive. Marjorie, okay, since you came late, let me give you a little bit of recap because you are a loyal fan, loyal listener of the show, and I have to put you into perspective. So first of all, you talk about urinary tract infection. We talk about in male and female. We talk about the complicated infection and the and the uncomplicated infection. The complicated infection, you must go to the hospital and get treatment. But the uncomplicated, you can depending on your underlying medical problems, the doctor may choose to treat you as outpatient. Okay? So women tend to have more urinary tract infection than men because women have more places to get infection. All right? So whenever you have an infection of the upper tract, as I explained to the audience, it can be complicated, and usually you have to go to the hospital. All right. So the second topic we're talking about now is the following. Now there is a rise. There's a preponderance of people preponderance of close relatives, first cousin who are getting married, and we know that it's very prevalent in the Haitian society, but it is not spoken. It's hidden under the rug. As many things in our culture, because we're so culturally restrained to talk about certain things. All right? Many Haitians do marry their first cousin. A lot of them, especially in the provinces, right? In the outskirts of the capital, people who live in the provincial. Now, so we talk about we ask a question. The topic is the rise in close relatives getting married, and we said there's a state in the United States that even allows, they find it's legal, they allow them for siblings to get married. So here's where we are. So let me hear what you think. Deborah said, exactly. How far are they going to go? In Canada, a man left his family because he felt like a 6-year-old. The family adopted him for company for their daughter. Next generation, birth defects. Next generation, birth defects. Birth defects and mutation. Next, great profession, psychiatry. Yes, we don't know what the world's gonna come to. And Woods Magali just said something that is mind-boggling, that there is a mother who was having a lesbianism relationship with her daughter. That's craziness. And very soon, you're gonna hear a father having a homosexual relation with his son. Et puis, il a dit c'est normal. Ou après, il a dit c'est normal. Ou après, blanc, il a dit normal. Et puis, Timoun nou, pour l'exposer avec Tintin sa yo, et puis Timoun yo, si nous pas lever Timoun yo bonheur, pour nous dire Timoun yo what is wrong, what is right bonheur. Ouais, Timoun a l'équilibre, depuis à 1 an, faut parler avec yo. Depuis 1 an d'âge, faut parler avec yo. Soit pas parler Timoun yo bonheur, soit quitter ses professeurs qui ont fait éducation petit tout, et pour ça lui-même, là, dit que it's okay pour gagner des mamans, s'il est ok pour gagner des papas, là, dit que c'est normal pour papa faire sexe avant, parce que moun sa yo un problème différent, parce que yo pas gagné même conception avant, parce que moun sa yo gagné un groupe qui pense même genre. Yo pense que ou marié avec maman à papa ou son mari qui normal lié. Yeah. So tout dans environnement ça yo, sou exposé avec yo, si moun a pensé c'est normal. So si moun a l'équilibre kounya là, qu'a fait kounya là, c'est petit monde qui fait tout confus déjà. Tout confus. Confus mais que tout est en bas. Mel disait que us as parents need to inform our children about extended families. As long as it is a family, stay away. I agree. Miranda Petit Frère, share the live. Bruni Haïtima, share the live. Rosemary Dacre, stop all the way. Yes, okay. Melody Dacre, stop the wedding. Stop the wedding. Okay. Melody Dacre, cancel. Okay, cancel. Disha Dacre will stop the marriage. Will stop the marriage. Ma gars, si kap gon seul monde kap di moui la. But too bad that en pile nous haïtiens, nous tout a disagree avec. Mais si gon blanc là. I think that most of you were African descent, were were Haitians or Caribbean. I don't think that this is our mentality. This is craziness. I don't think that we have crossed that barrier yet. I don't think we are that civilized yet to indulge in such craziness yet. I don't think so. I don't think so. We're not to that point yet. So I think most of you. Are we talking about one Asian guy? He's dating his daughter. Oh wow, who's that? That's craziness. He should be arrested. Disha Saint Laurent, he should be arrested. He should be arrested. Yes. He should be arrested. Assurément, the daughter is probably in early 20s, not really yet clear about her mind. And I wonder, I mean, of all the women out there, man, you see one woman you want to sleep with your daughter? And I know there are many Haitians, yes, many Haitians, who sleep with their daughter. That's true. Yeah. Mais ça nous pas parler, yo. Mais ça nous peut parler, yo. Ça fait que culture nous son culture hypocrite. En pile haïtien couché à petit yo. En pile haïtien. Yeah. Gen qui fait ça, États-Unis, yo voye back Haïti. En pile nèg fait ça. Nèg a petit li en forme et puis ba li du, il pa l'autre femme pour le prendre, c'est petit tout. C'est petit li. Comme si pas une femme de yo. That charge, craziness, man. Dog, you look according to the stories in the Bible. They were doing that back then. Well, I don't know. I don't know about that, but anyway, then and now is craziness. The man should come forward and let his wife know about any kid born out of wedlock to avoid this kind of encounters. That's military. Cancel the marriage, but will forgive the couple because did not know if they are blood related. Now, the next question I'm going to ask you. Let's say that your daughter wants to marry her knows that's a brother. What would you do? So the question now, everybody said cancel the marriage. But let's say that your daughter knows exactly, or she knew that the person that she's going out with is her brother. And despite she knew about it, she loved that man, she wants to marry that man anyway. What would you do? Sunday, share the live. I thought incest is severely punished in our society, and now to allow this type of behavior. Yeah. I know a few Haitians that married their first cousin. Yes, it's out there. Thank you, Marjorie. Maria que c'est prier pour nous prier. Yep. That conservative with people will not tolerate this type of behavior. True, I agree. Or he has been manipulating her since she was a child. I agree, Miriam Selo. That child has been manipulated, yes. Yeah. Means you can build in a closet. Yes, true. She will need an exorcism. Okay. Cyprien Vertil, brother Pam, salut. How are you, bro? Welcome to the show. Je snack some sense into her. Smack her. Okay. So, Cyprien, you just came on board. Thank you, brother. Thank you for me. Thank you. Cyprien, we're talking about the prevalence of the rise of marriages between close relative, first cousin, and recently there's a state in this state that allows siblings to get married. So we are going through this, and then we're saying that no Haitian culture, a lot of Haitian culture marry close with close relatives. Yes, a lot of Haitian. But the even worse, a lot of Haitian men have sex with a daughter. So what I'm trying to understand, guys, is that we are living in such a crazy world that if this is permissive, that two cousins can get married, two siblings can get married, mother can have sex with their daughter, father can have sex with their son. The next generation is a crazy generation. So I'm glad that probably a lot of us would not be around, because I'm feeling with a heart attack. Because kids who are born today, they are born already confused. They don't know, they would not know what is right, what is wrong. Because what they're gonna see, what they're gonna portray to them in school, that everything is normal. Because even now in school they tell them, par exemple, m'ba vle di ça en anglais, deux garçons, li normal pour yo marier, deux femmes, li normal pour yo marier, deux garçons, deux femmes, yo ka vivre dans kay. So, et dans l'école, yo di c'est normal lié. Ni normal. Tout le monde a li fait avec comme ça, li normal, li pas un problème à ça. Tandis que nous-mêmes, nous raised differently. Nous raised that a child should be raised by a mother, by a male and a mother. But things have changed completely. 360 degrees. Majority, once the world has become true, however, those things are not new, dog. They used to happen in Egypt centuries ago. The pharaoh could not go out of the lineage to get married. The bloodline had to stay pure. However, we evolve, and it's morally wrong. The parents sleeping with their children, it's called incest. They should be put in prison. And my sister, I agree more. Même d'après dans un côté, d'après en Haïti, depuis c'est vaca bon me connaît qui couche avec petit yo. Regardez, fait pas son loi pour couper ça bon Dieu ba yo. Yes. Tout nèg qui couche avec petit yo supposé couper pigeon yo. Ailleurs. Yeah. Et vagabond au moins au couche à petit tout, c'est ça on y fait. Yo supposé une loi de vous faire ça yo couper pigeon. That's it. Bon point, là je me fait. Au tracer une seule leçon. Mais on connaît qu'on y a là Haïti qu'on démocratie. On gagne de démocratie, tout le monde a droit. So nèg yo coucher à petit yo à l'aise en Haïti sans problème. She may not be in a real mind, therefore that girl needs medical advice. I agree. Robert Gay, salut brother, shut the live. On August 6, 2019, World News Daily report published an article posting that a brother and sister in New Jersey have been granted the right to marry one another after a 10-year court battle culminated in U.S. Supreme Court ruling in their favor. I saw that already. Exactly. Yeah, I saw it. Now, you wonder the Supreme Court ruling in their favor. So, what is it to tell you? The Supreme Court should be the last ditch stand of morality. The Supreme Court in any country should be the last ditch stand of morality. For a Supreme Court to allow two siblings to get married, where is the morality? So there's no morality at all. So you cannot depend on the justice system to bring morality into your children. You have to do it yourself. Okay? Disagree with all. We need to talk to our children to show them right and wrong. Okay. But okay, if a parent is to have sex with their children, not only is incest, it's abuse, and they scare the child for life, it is not okay. Ouais, généralement, ou d'accord? Couper ça, bon Dieu, bali. Mais même, me dit ça. M'ta président en Haïti. Des vagabonds qui couchaient avec petit yo, m'ta couper grain yo. Yeah. M'ta couper grain yo. Yeah. N'a make sure gon loi passer. Des vagabonds qui couchaient avec petit yo, ou couper grain ça. Ou après ça, ou fait ça une seule fois, ou on a haïtien caponnier, bah, je me fais ça encore. Jamais. Jamais. Ouais? Des bouts tracer exemple sur yon. Et puis fini. Ou après, pas une baille comme ça encore, même qu'a fait. Yeah. Parce que, conseiller de fois, for you to be a strong leader, you need to have strong measures. Strong measures. Ou pas qu'à un président pays, et puis, ou son mololo. You got to take strong measures. But the measures should be in the benefits of the people. Because there are many young women who was scarred for life because they are having sex with their father and they're afraid to talk about it. And especially in Haiti, where there's no place to go because there is no justice. The justice is bought anyway. There's no place you can go. So a young girl who's being raped every day by his dad, she's doomed to be like this forever. Forever. Funny, Doctor. What about a man marry his sister? Have you heard that, Doc? Man, my God. Whoa. I never heard of that, bro. Wow. Should. For me, we're living in a crazy world, brother. And I know that you are a man of faith. You're a man of God. And I know that's probably create a lot of anguish in you. And I know you said you have 3 children. So, brother, you should really make sure that you are the best counselor for your children. Because your children spend more time outside the realm of your house than with you and your wife. So, all right, bro. Mackenzie Jack, salut. Bébé is insane. Mais un gros pays, nous besoin prier et discipline petite nous. En pile nous oublier qu'il ti nous toujours abdi c'est Américain. Oui, en pile nous c'est Américain. On prend et même pas comme ça. Même petite moi l'aime grandi yo. Maintenant on savait. Maintenant on savait. On crache derrière, l'aime sur le gaz derrière. Yes. Ouais, a fait des Christians en Amérique, a fait gado. Ma bon manger, m'paye tout pour, ou, 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 ou doit respect complètement. Yeah. Yeah. After I parler de c'est America. A lot of you, a lot of Caribbean people, a lot of Haitian people. You have kids who are born here, and you tell me, oh, this is America, a great America, or let the kids do whatever they want. That's craziness. That's craziness. All right. You have to raise your kids according to the norms. All right. And many of you, you're doing 2 jobs, even 3 jobs, to pay for your mortgage, to drive a beautiful car, to buy fancy clothes, to buy the latest Gucci, blah, 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 blah. You don't have time for your children, and your children are being raised by themselves. And if you don't invest in your children, you're not going to collect anything. So for you to have productive kids, you must invest in them. Suspend faire 2-3 jobs. Bâti mon temps. Raise your child. Stop raising. Stop. I would say that suspend gonfler bank account. All right. Many of you like to pump up your bank accounts to see a couple of zeros after a number, and then you're happy. Meanwhile, your child is being raised by himself or by herself, and then tomorrow you said, okay, oh, what happened to my child? Because you didn't invest any time. Most of the time, they are repeating what they themselves undergo in their childhood with their own parents. The abuser always repeat the same behavior. That's correct, Marjorie. That's a fact that many of you that si nous besoin que pour petit non et successful, faut nous invest time, faut nous bâtir mon temps, bâtir mon temps. Et pas si t'as fait travail, bâton overtime. Il y a des gens qui toute la journée qui fait overtime. Yo à travailler à 7h du matin, 3h du matin, 3h l'après-midi, yo là, 3h pour minuit. Et souvent c'est là minuit,